All right, welcome everybody. It is 1:05, so thank you for your patience and waiting a couple of minutes. We now have 65 people that are on the line. So welcome, really excited to have you all here. My name is Sue Wilkinson. I will be moderating this session, and I'm the Executive Director here at Find Help Information Services 211 Central. So officially welcome to the 211 Data for Social Benefit National Webinar. We will start with some quick logistics. To ensure best audio, everybody has been muted. You've probably seen that. If you use the instant messaging box and it says capital IM in the lower left corner of your screen, you can ask questions or make comments. We will wait until all presentations have been completed before responding to questions. We anticipate that not all questions or comments will be addressed given the number of people on the webinar, and remind everybody that this is just the beginning of our conversation, and we hope to engage with all of you well beyond this session. It's the beginning of what we hope will be a fabulous long journey together. If you need technical support of any kind, please email or instant message Laura. Please note that we are recording this webinar for those who will be unavailable to join us today, and we will be posting that at some point and give instructions for people to access it. We're really excited to have such a large group of people. We have people registered from across the country for this event. Interest has far surpassed our expectations, and we're really inspired and excited by the response. So thank you all. You have been provided with a list of participants in case you're curious, and you will be able to see people's names on the screen. This webinar is the first for 211 Data in Canada, and we hope that you will find the opportunities created by our various data sets as exciting as we do. 211 has the most comprehensive set of data on the nonprofit sector available. As an example, in Ontario, this represents more than 60,000 organizations and services. This data supports online searches and it supports our direct service channels. In addition, call tracking allows for an understanding of needs and unmet needs, painting an interesting picture and unique value proposition for 211. We welcome today Andrew Benson, who will demonstrate the opportunity created through newly developed business intelligence tools. In addition, we'll have presentations from Toronto and Ottawa, and they will demonstrate how our data has been leveraged in its existing state. Harvey Lowe from the City of Toronto and Paul Steeves from United Way Ottawa, we're very pleased to have you both with us today. We have a few goals for this webinar. The first is to share with you all the tools of what is now possible with our new business intelligence tools. While it is a work in progress, it is quite powerful and exciting, and insights can already be gained. Secondly, we want to share some great innovations in how our current data is leveraged for social good. And finally, we're hoping to build a national community of interest and support for the evolution of these opportunities for social good. Ultimately, the 211 system in Canada envisions a future state where our data contributes to public education, policy development, research, and decision-making to strengthen our shared agenda. We are grateful as this priority has been enabled through the support of Green Shield Canada, through a frontline care grant. We would like to thank Green Shield Canada and acknowledge the leadership of our project partners, which include United Way Canada, Ontario 211 Services, and Find Help 211 Central. Following the three presentations, we will be inviting comments and questions. We particularly want to hear your thoughts on the possibilities and the opportunities. Our first presenter is Andrew Benson. Andrew is the architect for 211 Technologies for the 211 Ontario region, and described the nature, sources for, and extent of the 211 needs and resource data, providing some illustrations of questions that could be asked of the data. Andrew.
Well, thank you, everyone, and thank you, Sue, for that introduction. And it's a pleasure to be here as well with Harvey and Paul, as well as co-presenters today. I'm going to take about 15 to 20 minutes maximum to give you an overview of 211. I'd like to also talk to you a little bit about the journey, our transformation journey in moving towards an integrated system, both here in Ontario and across the country. And lastly, and probably most importantly for this webinar, I want to dig into the 211 business intelligence system and provide you with just a brief overview and demo to illustrate the data that's collected. As Sue mentioned, this is a journey, and we anticipate providing more detailed webinars in the future. So really, my goal is to just give you a sense of what is in the 211 data set today and the tools that we use. 211 is an easy access point to help navigate human service resources. 211 service is free and it's confidential, and in Ontario and Nova Scotia is available 24/7 and in more than 150 languages. 211 service is built on the most comprehensive standards-driven database of community, social, health, and related government services. And 211 data is collected in accordance with the standards and best practices set out by the Alliance of Information and Referral Systems, otherwise known as AIRS. And AIRS is an organization responsible for professional credentialing for individuals working within the information and referral sector, and accreditation of organizations to ensure the highest quality of service and data collection. The primary channels to access service, that is 211 service, are by phone, by dialing 211, and through a range of online services connected through 211.ca, and there are other entry points into the system online, including 211ontario.ca. As it stands now, 211's database of resources covers 80% of Canada, and 211 phone service can be accessed by more than 60% of all Canadians. Okay, so the slide that we are looking at right now are the components of 211 Ontario. Each province and Canadian territory is a bit different in its makeup and delivery of the service. This slide in particular illustrates the three components of value propositions for 211 service in Ontario. First, public inquiry. Public inquiry is information and referral services provided over the phone to the public through professionally trained specialists who assess needs and refer to the most appropriate services. Each year, 211 answers more than 350,000 calls in Ontario alone. The second component of the 211 service, online directories. 211 Ontario is powered by an online directory of close to 60,000 services that is accessed by information referral specialists and is available through www.211ontario.ca. Residents can navigate 211ontario.ca using a tool that enables searching for resources at the local level, or by browsing more than 150 topics available through the website in both official languages. A complete overhaul of the 211 online experience is nearly complete, and we also encourage you to keep your eyes and ears open for an announcement in the near future about that new online experience. The third component, and where we're focusing today, is tracking of caller needs. Information and referral captures the needs of callers, as well as needs that remain unmet after calling 211. 211 also captures important demographic information to make the best referral. Information that can be shared with funders and planners to ensure that dollars are invested where they are needed most and help to identify gaps in social infrastructure. Turning now to the strategic direction of 211 to give you a sense of where we've been and where we are today. With funding from United Way's Ontario Government and Trillium Foundation, 211 service began to expand in Ontario. About 10 years ago, in late 2000, about 10 years ago that journey began, but in 2011, 211 reached its goal of bringing 211 service to all of Ontarians. All Ontarians could pick up the phone, dial 211, and be connected to a specialized information and referral specialist. In 2012, attention turned to transforming the network of 211 local and regional services into an integrated system in an effort to fully leverage the collective expertise and resources without sacrificing the important connections and relationships to communities throughout Ontario. A vision for a future 211 state and roadmap to navigate the road ahead was developed. A key goal for transformation was to maximize our collective impact through strategic investments in shared technology. The vision and roadmap shown in this slide can be downloaded from 211ontario.ca. As mentioned, technology is a big part of our transformation story. With the business changes laid out, information technology allows us to really bring that change home. In particular, we laid out our vision within inside of the 2-in-1 technology framework, which is a conceptual framework of technical components and business capabilities that enable an integrated model of 2-in-1 service delivery. The framework is made up of 4 components. First, open data is a shared data repository that enables collection and sharing information referral records from across the province. Integrated phone is a cloud-based contact management platform that enables load balancing, meaning that in cases of emergency, our system is able to expand and respond with maximum capacity, and as well to route callers to the best resource to hear the issues and make proper referrals. Third, 2-in-1 Online is a web platform that enables easier access to online resources through search and directories for both the public, and also supports improved coordination of our many social media channels. And lastly, and why we're here today, is knowledge mobilization, which to us, as part of the framework, is a collaboration platform and business intelligence system that enables cross-sector collaboration and reporting on unmet needs and service gaps. The 2-in-1 vision for business intelligence is straightforward. Bring data together from a variety of sources in a manner that is easily accessed and understood by end users. And by end users, we mean analysts, researchers, decision makers, and even the public. The 2 overarching strategies that underpin our BI design are illustrated on the slide. First, data integration. Data integration, its very essence, is the combination of technical and business processes used to combine data from a variety of sources into meaningful and valuable information. A complete data integration solution delivers trusted data from a variety of sources. Second, and probably nearest to our heart, is self-service business intelligence, which is an approach to data analytics that enables business users to access and work with corporate data even though they may not have a background in statistical analysis, business intelligence, or data mining. In late September of this year, the BI system was released at the 2-in-1 Ontario conference. Over the course of nearly 2 hours, the key capabilities of uses of the system were demonstrated. Today, only a fraction of that can be demonstrated, but assuming there is interest in seeing more additional webinars and information of this type, we certainly can make ourselves available in the future. The contents of the 2-in-1 system is organized into 3 themes, as demonstrated on the slide. First, 2-in-1 calls. Second, 2-in-1 needs. And third, 2-in-1 resources. 2-in-1 calls includes information on calls made to 2-in-1, such as number of calls per day, location of callers, and the length of call. Probably most importantly is the 2-in-1 needs dataset. 2-in-1 needs includes information on the nature of the issues presented by each caller, the services callers were referred to, and the demographic profile of those callers. And lastly, 2-in-1 resources includes information on the 60,000 programs and services available in more than 1,400 cities, towns, and unincorporated areas throughout Ontario. So let's dig into the system to help bring this information to life for you. What we're looking at on screen is a static shot of our needs identified report, which I will demonstrate now. Today we highlight this type of information available within the 2-in-1 business intelligence system, focus on the reasons people call 2-in-1 and where they are referred, as well as caller satisfaction with the 2-in-1 service and the impact they attribute to having made the call to 2-in-1. Later on in this presentation, if time permits, we'll take you through a quick overview of how users create their own reports using our 2-in-1 data model. So we're now jumping into the business intelligence system to give you a sense of the information that's available within inside of the 2-in-1 calls data set. I'm going to start by showing you a presentation of the 2-in-1 calls by location. So on screen, we're looking at the total number of calls per month made to 2-in-1 for both 2016 and 2015. 2015 is the bars in gray. We also have information on the time at which the call was placed and the general location across the province in terms of regions. But what's most important about this particular piece of data is that we're able to dig into the 211 calls made to communities across Ontario. For example, if we're interested in looking at not just the calls to 211 by the full province of Ontario, we can dig into the Niagara region, and as well within the Niagara region, we can select the many communities that make up that particular region. So for example, I'm from Grimsby. If we're interested in understanding the number of calls made to Grimsby this year, we simply select Grimsby in the community, and the data is filtered and available for analysts to take a look at the number of calls to Grimsby versus the number of calls to another community, such as St. Catharines. If we're interested in looking at other regions, we certainly can go back and take a look at Hamilton, for example, versus Grimsby, or so rather Hamilton versus Niagara. So this gives you a sense of sort of the interactivity of the business intelligence system. Let's jump over to the caller satisfaction information. Each caller that places a call to 211 is asked if they would like to participate in an electronic survey at the end of the call. We have a large number of callers who choose to participate in the survey, which we're quite grateful for. This allows us to understand where we stand in their minds in terms of the quality of service they received. I won't go into all the metrics on screen today. The purpose really is just to demonstrate the range of information that we have available in the 211 system, but you can see that we ask people for their overall satisfaction with the 211 service, whether our information referrals specialists from their perspective are knowledgeable, respectful, and we also ask if they would call 211 again. We can slice and dice that information by the language of the caller, or whether that caller placed the call during regular hours from 7 to 7 during the day, or whether it's after hours or on weekends. We as well can slice and dice this information by region and community if necessary.
Andrew, there's a question. Ann Counter is asking, are these metrics developed in real time or is it historical info?
No, this information is fresh as of last month. So we're collecting this data on basically every second of every day, and then we compile it at the end of the month and deposit it into the business intelligence system. I'll also take some questions at the end, Laura, right after the presentation. So we're looking here at whether individuals, we're looking at the outcomes that people report. So in addition to the satisfaction survey, we also ask people to tell us how 211 impacted their life from a health perspective and other perspectives that they choose to share with us. So for example, we're looking here at information on the impact for callers and whether they received service down in the bars below, and whether they would recommend 211 service in the future to others, whether they feel better prepared, and whether their issues were resolved. Again, the power of the business intelligence system is that we have a data model that underpins all of these visualizations that make it easy for people to come in from the outside, not have to really understand the intricacies or the details of this data, but simply to click through the visualizations. For example, for those who reported that their health was improved, we can simply select that part of the pie chart, and the data is filtered to allow us to examine only those people who reported that their health had been improved by calling 211. As well, we have metrics down the left-hand side. So this gives you a sense of the information we collect on calls placed to 211 and how people interact with our service, whether they're satisfied, and the impact that we have. I'm now quickly going to jump over into the 211 needs information that we collect. We collect a range of information, of which unfortunately time doesn't allow us to go through quite a bit of this today, but you can see that we collect information on needs, unmet needs, referrals that our information referral specialists give to callers, follow-ups, demographics of the caller population, call length by need, and as well the public version of some of this information that we make available. So let's just dig in here to the needs information. I'll blow this up on screen here for you. What we're looking at here is a page inside of basically quite an extensive report that provides us with information on why people called 211, what the issue was and where they've been referred to. We're looking here at the needs that were identified from the calls placed to 211. Down in the donut chart, we're looking at the needs identified across 18 particular categories that we collect information on. We collect information on whether a need was related to healthcare, housing, income support, information services, mental health addiction, so on and so forth. But you can see again that we've built a system that has modeled the data in a way that allows for the highest level of interactivity with the data by simply clicking through the information. For example, if we're interested in taking a look at the needs of callers from the Niagara area, again, I'll focus in on Niagara because I'm familiar with that area, simply select Niagara, and now we filtered all the information only to look at the needs identified from callers from the Niagara area and the distribution of those needs across the categories such as healthcare, housing, income support, and assistance. If we want to hone in on males versus females callers, we can do that, and as well we have information on age categories which we're able to leverage. In addition to this information, we collect data on the unmet needs, which is important information for identifying service gaps. So in this particular page, we're showing the data surfaced on the unmet needs of callers and why those needs were unmet, such as they reported being ineligible for service, or we were unable to connect the individual because that service isn't available in the community. And you can see again that we're always separating out the data by 18 different categories of need, such as housing, healthcare, food, and meals. And the last page I'd like to share with you is how we hope to share this information out publicly. So not only is the business intelligence available for those within inside the 211 system or those who are interested in working with 211 to do research, or public policy makers, for example, working in local, regional, or provincial government, we also want to turn this information inside out and make it easy for the public to have a bit of a snapshot of this information as well. So what we're looking at here is more of a public-facing version of the 211 data that separates out the 18 categories and allows for the public to really dig into particular regions of the province to identify the needs across months and where they were referred. So for example, here we're looking at the total number of needs identified in the 211 system over the last couple of years. But if we were interested in looking at the number of needs related to utility assistance down again, say in the Niagara area, we can do that. We can look at other areas such as Lambton, Lanark, right across the province we have information on. And if we want to jump out to other types of needs such as income assistance or mental health, we provide that information as well. So I think what I want to do now is I'm going to hand it over to Harvey to take us down a different path, but want to share with you that there is a lot of information that we have not been able to demonstrate today because of time. However, as I mentioned, we intend to provide additional webinars in the future that will give you a deeper dive into this information. But hopefully what you've gotten today is a sense of the range of data that we collect here at 211, and that we've pulled together a fairly rich data model that allows for interacting with the data without having to understand the intricacies or details of the data that underpins our business intelligence system. So thank you, and I will hand it over to Sue for introductions.
Yeah, thank you, Andrew. That was fabulous. Just a reminder to people, if you have questions, you can instant message them in the bottom left-hand corner. It's my pleasure now to introduce Harvey Lowe. He is the Manager of Social Research and Information Management with the City of Toronto. And Harvey has been using 211 resource data for mapping purposes for many years. And if I remember the story correctly, I think that might go back to the mid-1990s. And it came in the form of big, heavy boxes of data that were being pulled from our computers. So Harvey, welcome.
Thank you, Sue, and thank you, Andrew, and everyone for having me. It's a pleasure to be here. You know, I've learned so much from everyone else around here. I've seen the great mapping that's been done on calls at 211 Ontario, and looking forward to hearing what Ottawa has to say. Happy to share with you our learnings of using this data in the City of Toronto. And what I want to give you today is a bit of a tip of the iceberg example of how we leverage 211 data for social policy and research purposes. 211 data is basically one of the central sources of information that we use at the City of Toronto. You've heard of the old adage that good decisions are based on good data, and this couldn't be more true when the use of 211 data. As Sue said earlier, it's all about social good. How do we use this data for social good? And it all started with us at the City of Toronto in 1996 when we had our first series of meetings with then the Blue Book to take that information out of those hard copy directories and move them into electronic formats that we could now use for better effective service planning. So let's take a look at some of the reasons why we feel that the data is so important. Why is 211 data important? Because, as I said before, good decisions are based on good data. Effective solutions require information for better metric-based planning, for better evidence-based planning. That's what we're talking about. That's the central mantra. So it does provide a factual base. It provides us a baseline to prove or disprove theories or assumptions. We use the data to analyze and explore alternative planning options, and we also use it to strengthen our organizational accountability. How does 211 help on the realm of informing social issues? As we heard before from Andrew, he mentioned the AIR standard. There is a standard. There's also a historically accepted precedent in how we define human services. Back in the mid-90s, the City of Toronto had not yet landed on a definition of human services. We simply went to the Blue Book at the time and we used the AIR standards. It also provides a sector that's constantly in flux, and I'll show you some slides that show that over time. As we see, the human services sector is constantly changing. It's constantly in a form of flux, and we need to keep on top of that if we want to do more effective planning. Finally, it provides valuable insights on how about services and combining with other types of services at the City of Toronto, and how we can use those services and the 211 data together and collectively to have better information to plan for the human service needs of the City of Toronto. I'm just going to go over this slide very quickly because it is dense in text, but what I want to show you is that our work with Find Help Toronto has evolved. In the 1990s, as said earlier, that was the first time where we began to use the human services data collected in the service directories, the Blue Book, to begin looking at our definition of the social services sector. In 1997, we began a role of the review of the potential of the Blue Book's data for research purposes. We began to think about protocols, processes for updating data, sharing, ownership. By the late 90s, we had refined the Blue Book data by adding in new fields of information that would kind of be similar to some of the coding that StatsCan would use as part of their business directories. It started to make that transition into taking an information referral database and making it planning relevant for the purposes of what we needed at the City of Toronto. We then began to look at the development of INT processes for faster data transfer. At that time, we were taking data from the servers at 211 through a T1 data transfer line and moving over to the city so we get instant access to the information. Now it's all over the web. In 2002, of course, we launched 211, Toronto's online mapping system, also evolved at that time where we began to map this information. It had never been seen visually at that time. We finally began to geocode it and begin to apply geographic XY coordinates to the information. What's important to note is that the information at that time was being married with standards at the City of Toronto. So, for example, one of the standards that we used was our address base. We have a standardized addressing base at the City of Toronto that Emergency Services uses. We worked with Find Help Toronto at that time to standardize the address. By the time 2011 rolled around, we rolled out WellBeing Toronto. I'll go over with you that planning tool in a moment. And finally, in 2016, we just launched last May Find Youth Services, which is a mapping app. I'll go over that as well in detail. But that's where we begin to leverage the newest technology and applications program interfaces, or APIs. So as you can see, there are many different sources of information that we have at the city. Andrew mentioned earlier, it's about integrating data. And that's what this slide shows. For example, the blue bubble up the upper left is our municipal data. That's the information that we would collect on our recreation, our city facilities, our libraries. The red circle is the 211 service directory data. That, of course, includes call center data as well. The bubble on the right, the orange one, is some national data consortiums that we're involved with. Right now, there's 30 Canadian cities involved in a community social data program that shares demographic information consistently across 30 communities, and we tap into that resource to marry it with 211 data. On the bottom, we have federal data sets. The National Census is a pretty big one that we all use at local municipalities and the NGO sector for planning purposes. And finally, this whole thing called community data and open data. We're now beginning to see information come back to the city from the community that have used our data. And we're now marrying that with the Blue Book information as well. So case study, City of Toronto. I'm going to take you through a couple examples on how we use the information at the City of Toronto. So the City of Toronto, like any large municipality, is really a city of many different communities. The service delivery mechanisms that we use at the city are basically partnerships with the community-based sector. We can't provide information and services on our own. We have to partner with communities to do that effectively. And also, we do that through a place-based lens. Everything is done through communities. So in Toronto, we have 140 neighborhoods. I'll go through that in a moment. But we have evolved into a complex and very sophisticated social infrastructure where we now begin to need to know how these communities are changing, how they're different across the City of Toronto. It's no longer just about the City of Toronto or how many calls or services. We want to look at that through a place-based lens. So I'm going to go through these major headings of how we use the data locally at the City of Toronto, from internal service planning purposes to showing you some online resources, notably WellBeing Toronto and Find Youth Services. I'll go through all of these right now. From its basic foundation, when we started using 211 data, we needed information about not only what services were out there, but where were they located. So for internal service planning, we use them for environmental scans. This is pretty basic 101 GIS geography, but very important. The two maps you see here are the two maps of our two major revitalization projects in Toronto. The one on the left is Jane Finch, including portions of Lawrence Heights, and the one over on the right is Regent Park. One of the first steps that we needed to find out was the nature and extent of human services in those communities. And this is just a simple example of how we map this information by category. Remember I talked earlier about codification? This data is coded actually based on 211 data, but using our categorization codes on top of the 211 taxonomy that give us an idea of what types of services grouped into certain sectors are located and where they are in the community. Here's an interesting map that we're also interested in looking at. Andrew mentioned this earlier, Geographic Gaps Analysis. The information that we have up at the top is information that we take snapshots of 211 over time. It's hard to see, and I got a better example coming up, but we can also use this information differently than IRR does, information referral. We keep track of how the sector changes. We have snapshots of the social services sector and where these agencies are located in Toronto going back as far as 1996. The map on the bottom right, I just want to take a few moments on that one. This one was a real request that we got from a counselor, where the question was, to what degree are the services in the community meeting the needs of the Chinese community? The map that you see, the chloroplath or tile map underneath, the darker purple colors, show where there is a concentration of the Chinese population. The yellow dots are where the locations of 201 information are that say that they serve the Chinese community. Now, one might look at that picture and say, well, everything seems to visually match. Where there are services, there are people where there's a high concentration of need. However, when we looked at this data and we peeled away the skins of the onion, we realized that it was a much more complex situation. What this data allowed us to do was to dive deeper, not only in terms of the data, but in terms of the issue itself. For those that serve the Chinese community, we know that there are many different dialects and many different communities of different economic circumstance. In Toronto, the ones in the downtown core are traditionally made up of older, senior Toishan speaking populations, now of course Cantonese and Mandarin. And the one north in the part of the city, which is Scarborough, is primarily new immigrants from mainland China, mostly Mandarin speaking and Cantonese. We found that there was actually a disconnect between the types of services that offered to the Mandarin and Cantonese speaking peoples. And you could see clearly that this map doesn't show it, but we had to view how we allocated resources to the agency so we can meet needs. A couple more examples. Here's a better example. This is a map that shows the Blue Book data way back in 1996, and then the blue dots are what we see now in 2016. Why is this important for service planning? Because we can see how the sector changes geographically on the ground over time, over this 20-year period. Here's another example of showing that same map, which just basically shows percent change in the number of services by the city's neighborhoods. And you can clearly see that some neighborhoods have appeared larger growth in community services, likely reflecting the changes in demographic patterns, settlement patterns, and so on in the suburbs of the city. This is another example of geographic gaps analysis where we map the diversity index that we use at the City of Toronto that measures the breadth and range of diversity of different ethnocultural groups. The darker the color, the more diverse they are. And the orange color, the more similar they are, or more homogeneous. And we're looking at 201 immigration settlement services. This map was used for our grants allocation work. Yet another one that basically shows the supply and demand analysis of recent immigrants, primarily from the recent immigrant variable off StatsCan and those services in 201 that provide services to new immigrants. Moving right along, similar, we have this information about the concentrations of youth and where youth services are. Now we look at site plan evaluation environmental assessments for you urban planners out there. The information that we share at the city is also shared with our planning department, and they use this information for official plan review, secondary area plans, and this is an example of how they use the information to map where services are when they're doing official plan reviews. Information for policy and decision makers. These are simply maps that we produce for the politicians and the decision makers so they know where their services are in their wards. On the bylaw standard front, this is a service scan template that is used as part of our 150-meter shelter bylaw requirement. And this is where every time a new shelter is established, we also use the 201 data to map other shelter and housing services in the community. And we've had instances in the past where without this information, community meetings would go on for hours because they were at odds about what was in this community. It doesn't happen anymore with 201 data because it's now geographically located, it's placed on this map, and it actually cuts those meetings in half where there's no hearsay or theory about where services are. Emergency planning, we have a nuclear generation plant over in Pickering, which is a municipality east of us, and we use the 201 data for outreach. And this is an example simply of a visual, and when there are environmental situations, we use this information as well for community outreach. On the side of partnerships, this is a recent study that students from Ryerson did, where they looked at various services in Toronto and they did walk scores and distance calculations using geographic analytical models like kernel density analysis. This is an example where they're looking at health services within 5 kilometers of where people live, and it basically shows that there is very good coverage in the downtown, less so in the outer areas. This information is very important for areas from grants applications to transit planning. It's very vital for the information that we use for services in neighborhoods. Different way of showing this information, this time for food and shelter services. Now on to how we use the data for strategic planning purposes. We have a city strong neighborhood task force that was developed, that was formed in about 2006 to look at the gun crimes in the city of Toronto. And the resulting policy question was, what do we do about gun crime and how do we make our programs much more relevant to those communities in Toronto that are at odds with crime and unhealthy communities. And what it ended up being is we ended up using the information from 211 to begin to identify those areas of the city that had high levels of demand and need in certain demographic sectors like poverty, crime, immigration, and we map them with the services. So what you end up having is you compare services to resident population by a walking distance model, and you end up with gaps in services. We're finally going to end up with a social risk score that we combine this information with demographic information to show where the challenges in the city are with respect to 201 data. And we end up finally with areas where we've identified, in this case, 13 areas, priority areas in the city where 211 data was relevant in determining where those areas might be. The call center data I will skip because we've talked about that before under Andrew's presentation. And again, we have used this in these areas for strategic planning at the city, and we will continue to use it on our new youth-based web portal. For those of you that want to explore yourself how this information was used, you can go to WellBeing Toronto and our new Find Youth portal. You can click on those links and you can begin to see how the information is used online with other demographic and other youth services. Finally, in conclusion, I'd like to wrap up and say that there are challenges with data silos, partnerships and engagement and building trust, but there are also opportunities. Standards, we want to mine the data for resources such as the call center data. We want to do that soon. And we certainly don't want to just simply jump to conclusions. We want to use this information. We want to leverage it with new technology as we are with APIs. And above all else, we need to think about how this information is used as open data, and Andrew alluded to some of those. So closing off that, I will entertain any questions.
Okay, we're going to hold questions until our final presentation is done, but thank you so much, Harvey. Always very enlightening and funny to hear your presentations.
Thank you, Sue.
So I'd like to welcome Paul Steeves, who is a manager for research and evaluation at Ottawa United Way. Ottawa United Way uses 211 data for community impact planning and reporting. So, Paul?
Great. Thank you very much. That was an incredible presentation, Harvey. A lot of inspiration there, I think, for local communities. Just a slight correction. United Way Ottawa is not there yet in terms of using 211 for community impact planning and reporting. But we are excited to integrate 211 data into our existing CI platforms. And what I guess I'm hoping to share with you today is the art of the possible. We're sort of early adopters, I guess you could say, of 211. And I think what Harvey presented is the gold standard. But what I'd like to share with you today are perhaps some quick wins for smaller communities. So our vision at United Way is to invest donor dollars where they are needed most and where they will have the greatest impact. And our promise is that the community will be measurably better because of the work of United Way and others. And there's three questions that essentially guide my work day to day. How do we know where resources are needed most? How do we know if they're having the greatest impact? And how do we know that the community is measurably better because of the work of United Way and others? And I think 211 increasingly will act as the glue that will bring United Way, policymakers, our municipality, other grant makers, and the private sector, frankly, together to hopefully sort of look at collective impact, understand where there are gaps in terms of service delivery and unmet needs in the community. So we're very excited about the direction that we're moving with 211. And we've done some initial polls of 211 data, and one of the things I've been grappling with is how best to extract value from 211 to help answer those questions that I referred to earlier. And the timing could not be more perfect for today's session because I saw an opportunity this past weekend at an event here in Ottawa called Partnering to Hack Homelessness. And it was hosted by Employment and Social Development Canada and DataFest Ottawa. So I delivered a pitch that focused on leveraging disparate data in order to create risk profiles of people who are in precarious situations and at risk of homelessness. So what we wanted to do, or what I included in my pitch, was a vision to develop a system so that we could target interventions that would help us intervene sooner and more effectively in order to prevent homelessness. So we want to develop a system that would tell us who are likely to need what services and where those individuals and families are. So the who, what, and where were the three questions that we wanted to answer. So we're quite fortunate. Andrew shared some data, 211 data with us, going back to 2014 that could be broken down by gender, that could be broken down by whether they were children and youth, male, female, adults. And And it allowed us to begin to explore the relationship between socioeconomic status and 211 calls. And I should add that I was extremely fortunate to have a group of 7 or 8 data scientists working with me to kind of link these two disparate data sets together. One, a geospatial data set, very similar to what Harvey presented there, from a local initiative here in Ottawa called the Ottawa Neighborhood Study, and about 7,500 211 records going back to 2014. And our objective essentially was to learn which socioeconomic factors contribute to 211 calls for basic needs. So as Harvey mentioned, this is sort of GIS 101 here. We're just looking at a choropleth map that presents socioeconomic status by neighborhoods, essentially a cumulative risk index that tells organizations like United Way where individuals and families are most likely at risk of kind of poor life course outcomes so that we could plan interventions appropriately. The other layer that you see on top, all of the small dots, just represent the 7,500 calls to 211 over the last 4 years. But what was really exciting is that my group was able to join 211 data to this geospatial data from the Ottawa Neighborhood Study so that we could start to explore different relationships. So I know this is very hard to read, but I'll just explain it very, very briefly here. What we're looking at on the x-axis here down here are basically the socioeconomic attributes that we gleaned from the Ottawa Neighborhood Study. For example, Aboriginal identity, lone parent families, immigrants and new Canadians, people in low income after tax. And what we wanted to do was figure out which of those attributes contributed to 211 calls. So we can see here that Aboriginal identity, I'm not sure if people can see my mouse, but on the far left-hand corner, Aboriginal identity is highly correlated to 211 calls for basic needs. So things like food, shelter, those sorts of things. So this is an important piece of information in terms of data mining. And I think it's all about starting with the right questions. And what's great about 211 is we can take those dashboards, the Microsoft BI dashboard that Andrew presented just a minute ago, and create spatial visualizations of that data, very similar to what Harvey was sharing with you. So for example, here we're just looking at a very simple heat map that will give us a sense of where the calls are being made for 2211 for basic needs. And you can see that there is quite a strong relationship between calls to 211 for basic needs and socioeconomic status by neighborhood. So on this map, we're looking, the red neighborhoods represent neighborhoods with the highest degree of socioeconomic risk. And this 211 heat map, you can see aligns to that map, that socioeconomic status map. And what's great about 211 is after you've performed your analysis and you've identified where there are perhaps needs in the community, you can start to build different mapping applications that can be deployed quite quickly and easily to say, look at things like female calls to 211 for mental health and addiction support. Or for this particular example, we're just looking at calls to 211 for just in general for mental health and addictions. So I just wanted to share with you the art of the possible in terms of how 211 data can be linked to data in a local context, so that you can begin to build these tools for community impact planning, for engagement, for policy research. I think the opportunities are endless. So very similar to Toronto, where Ottawa is going with all of this, I would like to see us get to a point where we can start to build population-based allocation models, supply and demand maps, and essentially use all of this as a common geographic frame of reference that can be used to bring groups together to best serve vulnerable individuals and families. So I'll leave it there for now, and back over to you, Laura.
Thank you, Paul. That was amazing. Really great to see the connection between the work that we're doing in 211 and poverty reduction strategies, which is really the foundation of why 211 was put together in the first place, and nice to see it presented that way. Thank you. So we now have a window of time for questions, and just a reminder to people that you can ask your questions in the bottom left corner. We do have several questions that have come in, and I will pass those on to the presenters, and you're all welcome to respond. We did have Christy ask a question just related to the percentage in Canada that do have access to 211 service. And very quickly, 80% of the country is now covered related to data. 40% of the country does not have phone service support through 211. John Quill will be sending out a video to everybody that is a very good visual representation of that, but I would encourage people also to go to 211.ca. It's a bit more complicated than we have time for explaining now, but certainly most major cities across the country do have phone and other channels of support through 211. To make a long answer a very short one. So I'd encourage you all to look at 211.ca. So first question is from Cheryl. And Cheryl asks, how are age categories broken down? Are older adults broader than 65 plus?
Yeah, thanks, Cheryl, for the question. It's Andrew. The age information is collected in two ways. What was presented today was essentially a roll-up of the detailed age information that we collect. We, of course, can't collect from every caller a wealth of data on their particular characteristics, but we, in certain situations, can get more details on things like age or ethnicity. So that information is available to us. It's not available across 100% of the data, but we have a general sense of the sort of the age category that's broken down a little bit more than the categories that were displayed today. There's about 6 or 7 categories in general that you can filter through our data. And there's a much smaller subset of that data where you can dig down into the actual age, whether it be 20, 22, or 36. But it's a smaller subset of that data just because we're not able to ask each caller, of course, their particular characteristics.
Excellent. Thank you, Andrew. So next question is from Matt. And Matt asks, what are other levels of geography available? Can we see data by neighborhoods or census tracts or forward sortation areas?
The question is again whether the information is available at different levels. Sorry, what was the question again?
The question is what other levels of geography are available, and can we see data by neighborhoods or census tracts or forward sortation areas?
Okay. Yeah. First of all, using the 211 data service directory information, because it is location based, there's 2 ways that we can use the data. We can use it by specific location, as you can see in the use of applications like WellBeing Toronto, or you can roll it up. You can aggregate it to, once you have it geocoded, you can use a spatial GIS tool to aggregate information up by various categories. So for example, if you have, let's say, 25 211 services located in a particular area, you can apply your own geography over it, use the GIS tools to roll those up to say that over 20% of these locations in this community, in this geographic boundary, are health services. This is entirely flexible with the use of 211. It's really a matter of having the tools that will allow you to do that combination, which many municipalities do have now, and probably the best to do would be to speak to some of those municipalities that have those tools to begin to see how they can integrate that data into a spatial environment.
And with respect to the sort of the microdata that underlies the 211 visuals that you've seen today from all the presenters, There's really two dimensions to our geography. So for the resource data, which is the programs and services across Ontario, which are 60,000 in the database, we map that right down to the latitude and longitude of the location of delivery. So that allows you to take, whether they be polygons or other administrative boundaries, and surround those latitude and longitudes to really create your own maps with whatever dimensions you want to put around that. With respect to the needs and the calls data, we are able to drill down to the community level, of which there's about 1,000 communities that are available across Ontario that exist in the data. So you're not able to get down to the latitude and longitude, but you're able to get down to, for example, Grimsby within inside the Niagara region of the province of Ontario.
Excellent. I'd also just like to add, sorry, just very quickly, there are free applications that can be accessed for those smaller communities who may not have the resources to do the GIS mapping. ArcGIS Online, for example, which I used for my presentation, and I should have mentioned that, has basically a free application that anybody can take advantage of. Not to mention R, which is an open source statistical analysis application, has a GIS plugin as well.
Excellent. Thank you, Paul. I was wondering technically how we were going to get you to answer without you being in the room. So glad you unmuted yourself and spoke up. Appreciate that. So a question for Andrew related to the 211 BI tools. What BI tool is being used?
Mm-hmm. So the tool that we demonstrated today is Power BI. We chose Power BI, first of all, because it's a leader in its space, and you can read more about it from powerbi.com. It's a Microsoft product. But I'll tell you why we chose this tool is that our vision, as I pointed out in the presentation, was that we, first of all, wanted to integrate to a variety of data sources. So Power BI enables that by allowing you to connect to different data sources, bring that data in, clean it, and model it. But probably more importantly in our choice was that it provides really easy tools for users, and by users, again, I mean analysts and decision makers, to really access the information that we've provided in the model. So Power BI provides you with these tools not only on desktop but over the web. So they're, I guess, sort of similar to what Microsoft products look and feel like in applications such as Word and Excel. It's an easy to use interface, if you will, to the data that allows you to visualize your information.
It might be helpful for people to know as well that because we are nonprofits and charities in this sector, we actually get incredibly discounted access to Microsoft tools. They've been very generous with our sector. So a question for Harvey. Harvey, could you explain how you use WellBeing Toronto and 211 data to inform evidence-based decision-making at a city level?
Yeah, I can answer that by giving you an example. We are working on several strategies, human service strategies. One is a youth strategy, another is a senior strategy. In those strategies, there are elements that look at a spatial or neighborhood lens of where services should be. So when we were developing in the early days of our strategy, we used WellBeing Toronto to look at where the clusters of seniors were living and where the services for seniors were located. But we also needed to look at other services related to that, because as you know, when you look at a complex human service issues, they're not one-dimensional, they're multidimensional. And so we need to begin to look at new immigrant lens, we need to look at low-income lens, we need to look at housing lens. All of those other indicators are also in WellBeing Toronto that would allow you to layer that information on top of where services are located and where seniors are. And we use the application to do some foundational planning and thinking about where those intersects would occur spatially.
Thank you, Harvey. Would anybody else Paul, would you like to answer that as well? I'm not sure if you're at the same point right now. As you say, you're in the early stages, but do you have a forward-thinking idea of how you will be using data for evidence-based decision making?
Yeah, I think we're fortunate in that we have a strong foundation. One of the initiatives that I referred to earlier, the Ottawa Neighborhood Study, is increasingly becoming that tool that both our municipality, our public health unit, as well as organizations like United Way are using to better understand the risk, resources, and outcomes at a neighborhood level. The gap as it currently exists is really the 211 piece, and I think that will give us a good sense of what services might be lacking for seniors who are isolated, or where early childhood interventions are needed to improve school readiness scores, for example. As I said, we're not there yet, but I think the 211 overlay on our pre-existing data will be a powerful tool going forward.
Thank you, Paul. So I have a question from Irina, I believe, and the question relates to how data is broken down by region. So in Simcoe County, for example, can data be broken down by communities like Collingwood and Orillia?
Yeah, how about I do this visually for you on screen, because I think it's easier to see than for me to describe. I'm going to go back in. So the question was, can we break down information on needs below the regional level? I'm going to jump in here then to jump into one of the reports to demonstrate this example. Let's go into the calls data, and let's take a look at the number of calls received. Again, this is something I presented but very quickly in the presentation. So here we're looking at the full number of calls in 2016 broken out by month, but this is for the province of Ontario. If we want to drill into a particular region, starting with, I guess we're up in the Collingwood area, so we'll need the region Simcoe, thank you very much. So here we have now the communities that have been filtered within the Simcoe area. So if we want to take a look at Collingwood in particular, we can select Collingwood from that community. You can see we're in the region of Simcoe, Collingwood, and we filtered that data to get a look into the total calls made from people living or at least making the call from the Collingwood area. We can do that across our calls data as well as our needs data. So yes, the answer is we can drill into the regional level, and as well we can drill right down into the community level as well.
Excellent. Thank you, Andrew. So I have a question from Stephen. Just need to find it. All right. So Stephen asks, what plans do you have to qualify qualify interest in and provide access to the Microsoft BI tools described by Andrew?
So this is actually, as we set out at the start of the call, it's really the start of investigating the demand for this type of information, as people such as Paul and Harvey have demonstrated. They've been working with this data for quite some time, very intimate with that data. Our hope is actually that we can generate broader interest in the data, probably not to the degree that you've seen from Harvey and Paul, but our hope is that the data is used in whatever context you choose. So there's a couple of ways of getting at that. We're investigating whether we can actually surface this data without the use of Power BI tools. So for those who aren't able to access Power BI through our systems, we're looking at how we can expose this information in a model that's open to the public to connect to. There's a variety of ways to do that, which I won't go into today. But really, this is the start of that conversation where we're trying to gauge demand and interest in our 211 data. Assuming that there is a significant interest in the data, we would of course figure out a way to surface that in a greater way for those outside of the broader 211 community. Again, maybe just to highlight a few things that we can do, though, for those of you who do have access to the tools, to give you a sense of what you can do. I've referenced the ability to go in and work with our data model. So this is very important to us when we are looking at the data, the micro data, if you will. Underneath, we've created a strong model of that data that allows someone to come in and actually take a look at the information right from scratch. So for example, just dragging and dropping the total number of calls received to 211, and then being able to layer over top of that the region of the caller, whether it be a 211 region, and this will be a bit messy, but this would be the regions across Ontario. But being able to do that drag and drop, that really easy to use tool in order to visualize the data that sits underneath, which is all being modeled. So our hope is that if there's strong demand for this information, that we would expose this model, potentially even out to the public, to use whatever tools they choose. We've chosen to sort of showcase Power BI here, but you should also know that the model underneath is accessible in a number of tools, including Excel or other popular reporting tools such as Tableau.
Okay, I'm going to move forward to a question just because it relates to what you have on the screen right now, Andrew. Matt is asking the question of who has or will have access to Power BI tools moving forward.
Right now, all of our service providers and partners across Ontario have access to this tool. And if there's broader access outside of sort of that 211 community, the service provider community that I'm referencing now, we would figure out a way to get the Power BI tools into the hands of those individuals. But more importantly, it's exposing the data model. So whether you're using this tool or whether you're using a tool that you're comfortable with, such as Excel or Tableau, the important point is here that we've taken all of our transactional data that's trapped typically in things like phone systems or call reports or other databases, and really brought this to the surface, not only in the form of raw data, but also modeled that for others to use the tools that they choose. So short answer is we don't have any immediate plans to expose sort of Power BI to the public at the moment, other than to provide some of the reports that you've seen today inside of a web browser that wouldn't require Power BI to access.
Thank you, Andrew. So a question from Anne. She asked the question of, do we have examples where the data is being used at a provincial government level?
We've provided, so keep in mind that this is launched in September of this year, so and late September as well. So this is actually the first public presentation of our data. Certainly this data is valued and used by a range of ministries, including the one that provides funding to 211 here in Ontario. There's actually a number of ministries that provide funding to 211 indirectly, but Ontario 211 Service is the key ministry as Community and Social Services. They certainly rely on this information being collected and shared with them in a variety of ways. But similar to my comment before around accessing the tools, we're still in the early stages of figuring out how to present this information. Actually, and value the input we get on conferences like today as to how to expose that information.
Yeah, and just a reminder to people, the tools are really new. They have just been very, very recently created, and that's why we're holding this webinar, to make sure that we raise awareness and engage people in, like what you said, Paul, the art of the possible. Mm-hmm. So Harvey has a response as well.
Yes, in terms of provincial use, to my knowledge, and I may be wrong, I'm not aware of any provincial ministries using the data in a similar fashion that we're using in Toronto. However, we didn't have a lot of time to go into details of the Find Youth Services portal that we launched last May, which is in the presentation I showed you earlier. But that portal was funded by the Ministry of Children and Youth Services, MCYS, and during that process, they were very keen on working with the 211 data so that we could come up with a much more refined taxonomy specific to youth services. And so what they did was they took the 211 data and they cascaded it out to their contacts at the province. And we collectively worked on and used that as input into a much more comprehensive set of taxonomies for youth services. So there is that type of work going on in that regard.
Excellent. Paul, I'm not sure if you would like to respond as well. Okay, not hearing anything. I'm going to move on to a question from Cheryl. And Cheryl's question is, has anyone used the data and overlaid it with caseload data? It is one thing to know where services are, but also good to know who is using them. Keeping confidentiality in mind, has anyone layered on actual user data?
At the city, we have worked with our Toronto Employment and Social Services Unit to look at the 201 data and indeed layer it with caseload data. I know that I've seen a couple of maps that they've done where they've loaded the caseload data with services. But the purpose of that layering was really about the caseworkers helping individuals in referring to services in certain communities. It was really used at that level, as opposed for any type of strategic planning purposes. So that we have done at the city, and we've done that type of work with our Employment Social Services unit.
Excellent. Okay, I'll move on to the next question. So, Andrew, this is a question for you. Can a municipality request access to the BI tool, or can anyone get access to it? Can a municipality request detailed calls, including geography for our region?
Mm-hmm. Yeah, absolutely. In fact, so I did reference before some limitations on everyone accessing the Power BI tools and this data. However, that's a good example of what we are able to do now. So on a case-by-case basis, where there is a strong interest in accessing this information, we can license the tools on even a temporary basis so that you can come into the data explored on your own. Or you can actually contact one of your 211 service providers. I would recommend the one closest to you. So there's 6 211 centers across Ontario, for example, that can as well connect you to this information. So there's a couple of ways to go about it. You can actually come in and grab it yourself, or you can work closely with a 211 center across the province in order to fulfill your information requirements.
Excellent. Okay, so the next question is a very technical one as well from Stephen. What is the form of the data model? Will it be published as a formal data schema, such as SQL, DDL, or equivalent data definition language?
That's like highly classified, so we'd actually have to kill you if we shared it. Yeah, really good question. If we had time, I could actually even show you the data model underneath. It's a fairly straightforward data model. It's being modeled actually using the business intelligence tools. So I won't get into the technical pieces of it. Happy to take that one offline. But rest assured that in order to navigate the information through the visualizations that we've provided through the tool, there is a model underneath. And essentially what you're doing is navigating through that model through the form of visuals, whether they be pie charts or bar charts. So yes, the model exists, and we know we don't have to kill you if we share that information.
All right, now I think this we're coming closer to the end of our time and a couple remaining questions. So Peter has a question on why and how has Toronto been so successful in driving resident uptake to use 211?
That's a great question. First of all, the biggest challenge that we had in the city was even thinking that we would even have a partnership with 211 back in the mid-90s, and we were overwhelmingly surprised how open they were as an agency, and that opened the door to everything. One of the ways that we've managed to have residents and community use it is we feel at the City of Toronto it is all indeed about openness. And through applications like Find Youth Services and WellBeing Toronto, it was a big step for us, but we wanted to have that information out there in the public that they could use for whatever purpose. And it's interesting you ask, because we find that a lot of people use those online services and those online portals for many different purposes. The biggest one is people use it to choose where they want to live. We have a lot of people coming to Toronto, newcomers who say, well, you know what, I don't know which neighborhoods have the supports I need, and we're finding that they're using it for that. So we found that the more you push that data out there, have less fear about what the information may say that people perceive as negative. We've often had, if you release crime data and you release demographic data and service data, are people going to be making the wrong connections? We've never had that problem. Just get the information out there. We're finding that it has huge take-up for the community. It just builds a tsunami, a good one, that people would begin to use the information not only for service planning, but for their own personal use.
Yeah, and I can add to that, Peter, that 211 was launched in Canada in Toronto in 2002, and so some of this just has to do with time. At one point in time, there was a huge investment in marketing and communication and promotion of 211. We certainly found in Toronto a drop in call volume as our marketing and communication dollars have been dwindled over time. And I would suggest that from everything that we hear, whether it's Toronto or beyond across the country, that every time people do hear about 211, whether it's the online tools or the data or the channels of actual support, people are overwhelmed by it and are so impressed, and we really need help as a system to really promote and get the word out about 211. It is a fabulous service, but the level of awareness across the country is incredibly low. So I'm going to take one final question here. The question is from Chris in Toronto and Ottawa. Do you use the 211 categorization of records when mapping, or do you create your own and supplement with other data?
I can start. We use the categorization of the information in several ways. First of all, we have what they call wildcard searches, where we can search on a description field, and we use the information that way to search for certain types of services that offer a certain type of program. The other way we use it is we hard code categories into each record. For example, we have used what we call a type of use category, where we've assigned it to each record. It's basically a list of categories of type of service that we've worked on with 211 to do that. We're actually thinking about moving away from that and working with a much more robust taxonomy. But we do have the ability to search the taxonomies a certain way. To give you an example, we had a request from a counselor that wanted to have a query on the 201 data that would give them the most up-to-date list of agencies that would serve a specific ethnocultural group. And now that's built into a standardized search at Find Help Toronto's end, and it's searching pre-populated and dedicated taxonomies. So there are ways that we're doing that, both through open text searches and to dedicated category definitions.
All right, Paul.
Yeah, and just to add to that, for the purposes of this presentation, yeah, we were just using the different age groupings, filtering the data by gender, caller type. So you saw in the example that I provided, female callers looking for mental health and addiction supports, for example. But just to add, because this is a conversation about the art of the possible, the direction that we're hoping to go in is basically linking our agency and program database to the 211 taxonomy. United Way Canada is moving in that direction so that these databases are no longer siloed and disparate. We can start to adopt a linked data approach to understand the relationship between geography, service distribution, and needs in the community.
Yeah, and I can just add to that as well to say that within the 211 data, and our focus is really on providing the data, not interpreting the data too much. We really leave that to those of in areas where there's a good interpretation of that data for policy use or decision making or gap analysis. But in terms of the actual categories, even though we focus today, or I focus today on 18 categories, underneath that, there's actually the ability to drill into hundreds of different subcategories of that data. So for example, housing would have multiple subcategories underneath.
Excellent. Well, thank you all.
Oh, sorry, I just wanted to add one.
Harvey.
If you go to the Find Youth Services portal, you'll see when the ability, and the link is in the presentation, you will see that the drop-down list of searchable categories for the youth services are much more refined through that work that I described earlier, through the funding from the province, the work with Find Help Toronto. And that will give you an idea on how we're using some of those taxonomies and categories for searches.
Excellent. So this is a point where we say goodbye. I really want to thank our very inspiring and knowledgeable presenters and participants as well. We've got a table of thought leaders from across the entire country on the line. I know all of your time is very valuable, and we really appreciate you joining us. For us, this is just the beginning of a journey, and we want to continue the conversation with you. On that note, you will be receiving an online survey tomorrow that will ask for your comments, your feedback, questions, and interested in staying connected related to the art of the possible. We really look forward to building on this useful beginning together with those of you that are interested. The potential for 211 data for innovative initiatives for social benefit has been spoken to in a variety of ways in the past hour and a half. Our goal is to turn this discussion into action that will lead to social change, and we hope that you will join this journey with us. And on that note, I will sign off and thank everybody for your participation today. Enjoy the rest of your day.